Hi everyone, I'm your friend Jasmine Swaneriap, your second year student nurse from Davao Doctors College. And today I am going to perform Leopold's maneuver. So this maneuver is a standard palpation for the abdomen for assessing the fetal position, presentation, and degree descent. So first things first, let's perform hand washing to prevent the spread of the microorganisms. So now greet the client appropriately, introduce yourself, and verify the client using the two identifiers. Of course, ask the client on how she would like to be called during the assessment, and establish a good rapport so that the patient won't feel uncomfortable during the assessment. Then explain the procedure to the client and give the client the opportunity to ask or raise for her concerns. Then this procedure cannot be performed with a full bladder, so that let the patient empty her bladder first, because emptying a bladder promotes comfort, and of course fetal contour will not be obscured by a distended bladder. Hello ma'am, may I come in? So asking the patient's consent is necessary. Hi ma'am, I am Franz, your attending nurse for today. So may I know your name?
Ate Paraiso, nurse.
When is your birthday ma'am?
February 16, 1998, nurse.
So am I correct that you are 23 years old?
Yes, nurse.
Okay, so before that ma'am, is that okay that I'm going to check for your wristband?
Sige naman.
So by the way, on the procedure that I will be doing is that I am going to perform the Leopold's maneuver.
Leopold's? Ano na yun na, ma'am?
Leopold's maneuver muna siya ang assessment or procedure na akong buhaton para ma-determine nato ang position o presentation ni baby sa imong tiyan.
Sige, ma'am.
Okay, so do you have any clarifications or concerns?
Wala man, ma'am, pero safe man na, no?
Don't worry ma'am, because this procedure cannot hurt you and your baby. So first ma'am, is that okay that we're going to empty your bladder first?
Sige, ma'am.
Okay, so I'm going to assist you ma'am. So are we all good now ma'am?
Yes, nurse.
Okay, so as you can see ma'am, the curtains and doors are closed so that there will be no other people who can see us. So before we start the procedure ma'am, do you feel pain or are you uncomfortable?
Dili man, ma'am. Okay lang man ko.
Okay, so that's good. So we are going to start the procedure in a few minutes.
Yes, ma'am.
So now the first thing to do is position the patient into a supine position with pillow under her head and slightly flexed knees. So this is done for us to facilitate accurate assessment and of course providing comfort. So ma'am, I am going to position you into a supine position. Is that okay?
Yes, ma'am. Matabang lang ang tako.
Okay, so no worries na ma'am. Data ma'am ha. So now this rolled towel, let's position this into the other side of her back so that we have an easy access of her abdomen. So ibutang na ko ni ma'am ha. Lift na itong kamay ato ang likod. So now, if you are right-handed, stand at the right side of the patient. And if you are left-handed, stand at the left side of the patient. So I am right-handed, so I am standing at the right side of my patient. So now, slightly lift her shirt and of course, expose only the specific area. and ask permission before doing so. So ma'am, okay lang ma'am, ato ang expose ang imuhang tiyan ma'am. Gamay ako alang isa ka gamay ang imuhang t-shirt. Okay lang na ma'am?
Yes, ma'am.
Okay. So ma'am, i-flex na to gamay ang imuhang tiil ma'am ha, or pwede nimo isaka ang imuhang tiil gamay kana medyo nakasaka ang imuhang tuhod. Para ni siya ma'am, comfy ka ma'am pag magbuhat sa procedure. Okay lang ma'am?
Yes, ma'am.
Saka na to ma'am ha, tamahan kita. So now, let's do the first maneuver. So face the patient and palpate the uterine fundus to determine what part of fetus lies in the upper part of uterus. So you can do this sign or symbol in your hand so that it is easy for you to palpate the abdomen. So ma'am, start po palpate sa tiyan ma'am ha.
Okay, nurse.
This is for us to determine if the baby's head feels hard and round. So freely movable, ballotable, and the nodular is softer. So for the second maneuver, palpate in a downward direction on the side of the abdomen by applying a gentle but deep pressure for us to determine the position of fetal extremities, fetal back, and anterior shoulder. So, ma'am, magpalpate ko sa imong tiyan ma'am ha, para ma-determine na to if asa nagatubang si baby. If nabaya diri ang likod or diri ang side.
Sige, ma'am.
Also done for us to determine if the side of the fetal back is felt in a long continuous structure and the side of the extremities will feel nodular and reflect the portion of the fetal. So ma'am, nara ang shoulder ni baby ma'am oh.
Wala, no.
So now let's proceed to the third maneuver. Place one hand over the symphysis pubis and grasp the lower uterine at the segment between the thumb and the fingers to feel the presenting part. So ma'am, balik ma'am ha, palpate ko sa imuhang, or ganito lang po ang imuhang lower abdomen. Okay ra ma'am?
Yes, ma'am.
Okay, so ganito lang po ma'am ha. So this is for us to know if the engagement has occurred and if the fetal feels fixed in the pelvis. Also, if the head is at intel or in the pelvis in zero presenting part is still movable, this means it is not yet engaged. So for the fourth maneuver, turn and face the woman's feet for us to confirm the findings in the third maneuver. So and for us to determine the friction of the fingers into the pelvis. So ma'am, magbalik ko og gunit sa imong lower abdomen ma'am ha, okay lang?
Yes, ma'am.
So it is for us to know if the cephalic prominence is felt on the side where there is a greater resistance to the descent of the vertex. So after the fourth maneuver, locate again the fetal back of the fetus, then place the stethoscope over it. And listen for the fetal heart tone for 1 full minute. So for us to know if the baby's heart is normal, we should hear 110 to 160 beats per minute according to the pituitary group. The note for the location, rate, and the character of the FHT for documentation afterwards. So before we place the stethoscope, we should, of course, clean it with alcohol. And dry it and warm. So, ma'am, mag-locate ko balik sa kuan ni baby ma'am ha, sa iyahang fetal ba?
Sige, wala problema.
So, ma'am, magbutang ko og ma'am ha, stethoscope sa iyong kuan. So, use the bell of the stethoscope. So, ma'am, ang FHT ni baby, ma'am, is 120/157.
Ang sa ganyan ang FHT, ma'am?
Muna siya ang heartbeat ni baby, ma'am.
Sige, normal
So,
lang man yan, ma'am, no?
Yes, ma'am. Normal lang dyan na siya. Okay, ang normal fetal heart tone is naalang man siya sa 110 to 160 beats per minute. So, now, you're all done, ma'am. So, ako ang ma'am, ha? Ibalik ang imuhang shirt, then, of course, pwede na natin ibaba ang tubig. So, okay lang. Ako ang ibalik yung imuhang kuan, ma'am.
Sige, ma'am. Palihog ko, ma'am.
Taba na tayo yung tuhod, ma'am, ha?
Ma'am.
So now that we are all done, do the aftercare and of course document the findings and do not forget to perform hand washing. So today I have examined Althea Paraiso, a 23 years old, at 38 and 5 days pregnant with her first baby. So all the findings are normal and it was palpable. So upon hearing the FHT, it results 120 beats per minute and it is normal. So now I am going to document all the findings upon the assessment and procedure. So now, ma'am, we are all good and done. So how do you feel after the procedure, ma'am?
Okay lang, ma'am. Happy ko. Kaya healthy si baby. Tapos food ko kung asa siya nakatubang, asa yung likod. Thank you kaayo, ma'am.
Yes, ma'am, you're welcome, ma'am. Then thank you for your time and cooperation, ma'am. Hope to see you next time. Then take care always.
Thank you, ma'am.